Hey everyone, and welcome back to my channel. If you're new here, then thank you for stopping by. Please go over and check out my previous video called What is Lipedema? That way you're all caught up for this one. In today's video, we're going to talk about all the different treatments for lipedema, whether that be management tips to help slow the progression of your lipedema, or whether that be surgery to help remove most, if not all, of the lipedema. Before we get started, I just wanted to thank you guys for all of the support and love towards my channel. I could not believe how many people reached out and how many people shared their stories, and I'm just so grateful to be able to have this channel and connect with all of you guys. So let's jump right in. One of the first things that we're going to go over is symptom management and ways that you can hopefully slow the progression of your lipedema. Although lipedema is not the same thing as lymphedema, our lipedema tissue still excretes extra fluid in around that tissue. So one of the main things that we can do is apply compression, and we can do that through compression garments. And what that does is help force inflammation out of your legs and your arms and prevent it from filling back up. From my understanding, it's best to wear these compression garments over the course of the day and take them off at night. And you'll want to wear those on any places that you believe you may have lipedema. So for me, I wear compression leggings that go from my ankles up over my abdomen and then sleeves over my arms. Due to the sensitivity to touch that a lot of us have, sometimes this compression can be pretty uncomfortable, and it is of course very tight. So I recommend starting with a lower compression and moving up as your body tolerates it. So there are tons and tons of different places that you can buy this from. You can get them prescribed from your doctor or physical therapist. They have some on Amazon, and there are other websites. If you would like me to do another video that gives more insight as to where you can find these compression garments, then please let me know. The next thing that could help manage your symptoms would be like a pneumatic compression pump. What this is like a sleeve that goes over your legs, and it fills up with air, and so it has that compression, but then it also massages at the same time. So it's encouraging that flow of fluid through the lymphatic system that may help with some of that fluid retention. I believe that you can get this prescribed through a doctor or physical therapist as well. I'm not 100% sure because I do not use this myself, but I can definitely do more research into that if you guys would like. The third thing on my list would be to find a physical therapist that specializes in lipedema. For me, this was kind of difficult because I live in central Iowa, and there's really nobody in the state that does work with lipedema. But I was able to search ones that were specially trained in lymphedema, and I called around, talked to them, and asked if they had anybody that works with lipedema as well. I was able to find somebody that has worked with lipedema before, and she's going to be doing the lymphatic massages and compression with me. I start that next Thursday, but she did state that these are more of management things, and if I'm wanting to document this for insurance reasons, it will not get rid of the lipedema. These physical therapists can usually order you custom compression, so do measurements to make sure that it fits you perfectly and has the right type of compression that you need. If you are wanting to see a physical therapist, most times in order to have insurance cover the physical therapy, you need to see your primary doctor and ask for a referral. The next thing on my list would be specific kinds of diets. So like an anti-inflammatory diet where you're avoiding processed foods, saturated fats, meat that are high in fats, and of course eating lots of fruits, vegetables, and drinking lots of water. There's also been studies going around on keto being something that will help with the inflammation and the symptoms of lipedema. For me personally, I choose not to follow either one of these diets. I'm on one specifically for the gastric sleeve surgery that I had almost 6 years ago. But my biggest advice would just be to eat healthy, and take care of your body. As much as a lot of us don't like to hear the term weight management, there is some benefits to trying to lose some weight if you need to, or maintaining your weight, because keeping this non-lipidemic fat down is very important in slowing the progression of this disease. And finally, exercise. So of course, exercising is just good anyways to help take care of your body, which I know can be very hard in these stages of lipedema because of the pain and for the people that have some immobility issues. But doing regular low impact exercise can really help the inflammation in your legs, and can also reduce the symptoms of hormonal fluctuations, which we know lipedema is generally triggered by your hormones. So this would be something that I would definitely incorporate into your life. So I know there are probably a lot more different conservative measures that maybe some of you have tried. If you have any ideas, please put those in the comments for people watching. That would be amazing. But essentially, the conclusion of this list is that they are management tips and they will help decrease the progression or relieve some of your symptoms, but they will not get rid of the lipedema. Ultimately, take care of yourself. Try to keep the non-lipedema fat down as much as possible and buy some compression. So now, what is the best treatment for lipedema and how can I try to get rid of my lipedema? Ultimately, liposuction surgery is the most effective way to remove most, if not all, of this lipedema tissue. So although it isn't a cure, it can provide massive fat reduction, which of course alleviates your symptoms and can reverse the stages of lipedema. So essentially, this is going to be your best way to get rid of most, if not all, of this lipedema tissue. If you are thinking about going this route at this point, then you will need a board certified plastic surgeon that specializes in lipedema. Not every plastic surgeon can do this. It is a very specific type of liposuction. It is not cosmetic, it is reconstruction, and it is a lot of lipedema tissue that they're going to have to remove. The treatment process with surgery will take several surgeries. I've seen some say it's taken up to 5 to 6. I think that really depends on which stage you are at though. And you can also likely get that reduced down and not as many surgeries if you're able to find a doctor who will do high volume removal. A lot of these surgeons will also do skin removal in the affected areas where they removed the lipedema if it's needed. But again, that it kind of depends more on which stage you're at and how much skin you have there. Also, I would have several different consults with different surgeons because you want to find the one that's going to be the best pick for you. And if you're wanting any chance of insurance covering it, then you need to document every single conservative measure that you have tried or you're trying now in order for them to see that those things are not working and surgery is what you need at this point. One of my next videos is going to be an entire video based on insurance and how to get insurance to cover your surgeries. So if you would like to see that, then please make sure that you subscribe. And of course, I would just start saving money now, because even if insurance does cover it, you're still going to be responsible for those deductibles and the max out of pocket. So just set yourself up for success. I did not, and I'm going through that right now. So with that being said, the last little bit of this is make sure you have a good support system that understands, somebody that's willing to help you go through these surgeries and heal. And if you don't have that, or even if you do, I highly suggest joining a group on Facebook called Liposuction for Lipedema. I will put the link in my description, but it is just a very supportive group of people that are all going through the same thing and in the process of getting this surgery just like I am. I'm going to include some pictures right here just to show you guys how much of a benefit having this surgery can be for you. So check those out and I'll be right back. Thank you guys so much for watching this video and for supporting my channel. It means the world to me. My next couple of videos are going to be on insurance and how I'm getting insurance to pay for it, and also my story. So from childhood on up to my diagnosis and what I'm going through now to get prepared for surgery. So you'll definitely want to like and subscribe in order to see that. And if you have any questions, as always, just leave them in the comments and I promise to respond. See you in the next one.